Hi everyone, in this video I am going to demonstrate how this pulse oximeter is going to work and how to use the pulse oximeter. So this is a BPL pulse oximeter which I got from the Amazon. In 1935, the first oximeter has invented and started using as a pulse oximeter in the year of 1972. So this is the artery which carries the oxygenated blood, and this is the vein which carry away from the organ, that is, which carry the blood away from the organ, which is in the form of deoxygenated blood. A blood which is rich in oxygen, and this one, that is vein, has a blood which is rich in carbon dioxide. Oxygenated hemoglobin absorbs the more infrared or near infrared light. So oxygenated blood, that is artery and arterioles, absorb the more IR or infrared waves, whereas this vein or venous blood, venous hemoglobin, absorb a red light, and it absorbs very less amount of the infrared light, whereas artery absorbs the very good quantity of infrared lights, where very less quantity of the red light. So using this phenomenon, they have designed a equipment which has a light emitting diode and the light receptor or photoreceptor diode here. So this emits a infrared or near to infrared waves as well as the red light, and here this is the photoreceptor. This is the photoreceptor diode. So whenever I place the finger here and switch on the machine, so it emits the photo IR and the red light, and here it will receive the amount of the IR which crosses my finger and the amount of red light which crosses my finger. So based on this, it will calculate the amount of the light which is received and the photoreceptor diode, and it will calculate, based on that, it will calculate the amount of oxygen in my blood. So how to measure this? So this should not be measured under the high intensity light. Even tube light, halogen light is still okay, but not under the any high intensity light. So it's better to flatten your palm on the table and make sure that you have the skin has the normal temperature. So if it is very cold, you can use rubbing like this and place over the table and switch on the machine and place over any of your finger. Wait to 30 to 90 seconds, and after that you can take two readings here. One is SpO2 reading, that is saturation, and another one is the heart rate reading. So the most important for us is the SpO2, that is saturation, oxygen saturation is supposed to be more than 95. This tiny instrument works on 2 into 1.5 watt AAA batteries, and it has very small monitor here, and it's very easy to operate, that is a single press operation. So just press button and place the finger, that's going to be more than sufficient, and you can clean the instrument by using any disinfecting agent or hand sanitizer, the monitor as well as the finger placing area. So that will avoid you the spreading of diseases. So dear friends, this is all about how the pulse oximeter works and how to use the pulse oximeter. If you like this video, then kindly subscribe to the channel and press the bell icon. Dear friends, the link of the instrument is given in the description. If you are willing to buy it, you can buy it through the Amazon. Thank you. Thanks for watching my video.